Hi, this is Dr. Keith Lewis. I just finished a series of learning lunch lectures this past week, and surprisingly, or maybe not surprisingly at all, one of the major questions or primary questions our patients have been asking us are questions about vitamin D, the need for vitamin D. Do we need vitamin D? They've been seeing it on the radio, on TV, on Oprah, Dr. Oz, Dr. Hyman, all talking about vitamin D. Vitamin D truly is an essential part of one's dietary needs. Vitamin D, although called a vitamin, in a truest sense is actually a hormone. It's involved in all steroid hormone synthesis. Patients we find that have depression issues, anxiety issues, hormone imbalances, whether it's estrogen, testosterone, cortisol levels out of balance, even cardiovascular disease and cholesterol issues, typically have shortage of vitamin D in their diet. Consequently, they aren't producing much vitamin D because of lack of exposure to sunlight. As many of us already know, vitamin D is produced when we are exposed to the sun. It is synthesized in our skin and large intestine, and if we have adequate exposure to sun, roughly 20 minutes per day, our bodies can actually produce enough vitamin D. Unfortunately, in the Midwest, where we have many gray days for roughly 4 to 6 or even 7 months out of the year, we don't have enough exposure to vitamin D or sunshine. Consequently, our bodies don't produce vitamin D in adequate quantities. We typically recommend that our patients add additional vitamin D to their diet through nutritional supplementation. We have found that many of the guidelines that have been printed for vitamin D usage over the past year or so have been grossly low. If you would have asked me 6 or 8 months ago what was the normal dietary intake of vitamin D through nutritional supplementation, I would have told you to take 400 to 600 international units per day. However, with the proliferation of new research that's become available, I'm now recommending my patients consume 4,000 to 5,000 units a day, assuming their vitamin D levels are normal. If their vitamin D levels are not normal, their lab values are less than desirable, I would recommend 10,000 units for approximately 90 days, then redo testing. Vitamin D also does come in a fortified form, which the body does not very readily or very acceptably absorb. And as I said, vitamin D is essential, for many bodily functions. So, if you're not in the sunlight much, you live in the Midwest, or even if you live in a sunny environment and use sunscreens, you certainly should consider vitamin D as a necessary nutritional supplement and as a daily, normal, functional part of your diet. Thank you. Yours in good health. We'll talk to you next time.